Glycemic control is one of the main problems in primary care and also specialty care today because it's a multifactorial approach, absolutely involving patient compliance. However, there are other barriers to compliance, and those are process barriers on how we provide the care to those diabetic patients. But patient compliance and also provider compliance or healthcare provider compliance has a lot to do with one of the barriers that prevent us from achieving ideal glycemic control in that patient population. Process of how we provide care to diabetic patients is one of the barriers. There are several evidence-based solutions that can help practices remove those barriers to increase patient compliance and also really improve their A1C values, which the research has shown will prevent complications in that population. One relatively simple solution is just expanded access, the patient's expanded access to the medical record, and frankly, increase patient virtual encounters with the patient that is beyond this traditional face-to-face visit that we think that patients have to do. So beyond even telemedicine, beyond a simple telephone consult with the patient, expanded virtual access to the patient, whether web-enabled visits or utilization of other than provider personnel such as RNs to help facilitate patient access to their lab results and also compliance with those things that we need them to do to keep their A1C level down. And lastly, patients that are satisfied or practices that know their satisfaction levels also have better compliance with their diabetic patients. So patients that are happier tend to be more compliant with the recommendations from their provider, whoever that provider may be. Historically in medicine and nursing, we start looking at medications, we look at evidence-based or clinical guidelines and drug trials to treat these conditions that are worsening over time, diabetes being one. However, when we're talking about process changes, how we provide care, we're changing essentially tens or dozens of years of embedded cultural changes. So when we're telling a practice that they should expand beyond a traditional face-to-face, that kind of slaps in the face of they need to come see me for their care. And so, though we say it's simple, what I say it's simple to maybe institute virtual practice, patient visits, the actual practice change internal to the clinic would be a big shift because the patient will not be coming to them. And so they may say, well, coding and billing may become an issue, or reimbursement for that visit. How do you get reimbursed for it? Because practices survive off reimbursement. And so there are many other obstacles beyond just simply instituting web visits that would change, but also having providers and nurses buy into the fact that you don't have to see the patient face to face. And the patients have to buy in that they don't need to physically come see you every time they need something regarding the diabetes care. And so it's a culture shift for patients and practices alike to kind of institute some of the recommendations that I mentioned.